Hello everyone. These 4 foods are known as the king of kidney damage. One bite can cause a hole in your kidney, putting you at risk for uremia. After reading this, quit eating these foods immediately. Latest research, a kidney disease nemesis has been discovered. Consume this every other day and you'll live to 99 without kidney disease. Although uremia isn't cancer, it's even more terrifying. Many people think it's a distant disease, something only experienced by the elderly, unlikely to strike us young. However, cold medical data is shattering this naivety. According to the latest annual scientific report on kidney disease in China, the prevalence of chronic kidney disease in my country has reached 10.8. This means that 1 in every 9 Chinese people suffers from kidney disease. Even more alarming is that this number has nearly tripled since 20 years ago and continues to climb at a rate of 0.5 per year. When we focus on the uremia population, we discover an even more shocking reality. Statistics from the National Center for Kidney Disease Control and Prevention show that 4 out of every 10 patients with uremia are between the ages of 10 and 30. This data reflects the quietly spreading silent killer among young people. In clinical practice, it's not uncommon to see 20-year-olds with uremia and 25-year-olds undergoing kidney transplants. These young patients often have lost over 70% of their kidney function by the time physical examinations reveal them. Why is uremia increasing in number, and at a younger age? A deeper dive reveals 3 key factors driving this decline: modern lifestyles. 1. Why is uremia becoming younger? These 3 factors contribute to the younger age of uremia, and many people are falling prey to it. Reason 1. Holding urine. In daily life, we often hold urine for various reasons. However, did you know that this seemingly insignificant act can potentially cause numerous health risks? First, we need to understand that urine is a mixture of waste products and excess water produced during metabolic processes. When fluid accumulates in the bladder to a certain level, the body experiences the urge to urinate, signaling the need to urinate. If these fluids and waste products are not expelled promptly, the bladder is forced to bear the additional burden. Prolonged urination overstretches the bladder muscles, affecting their normal contraction and relaxation, leading to problems such as difficulty urinating. More seriously, holding urine can cause urine in the bladder to flow back into the kidneys. The kidneys, as important excretory organs, filter waste and excess water from the blood, forming urine for excretion. If urine backs up into the kidneys, it disrupts their normal function and can lead to a range of kidney problems, such as pyelonephritis. Reason 2. Staying up late. In today's fast-paced world, staying up late seems to be a common occurrence for many people. However, are you aware that sleep plays a crucial role in our health? It helps eliminate fatigue accumulated after a busy day and allows organs to repair and recover during this relatively quiet period, thereby boosting metabolism and helping the body eliminate waste. Excessive late nights, however, are like forcibly disrupting the body's normal operating mechanisms. This can affect the body's endocrine system, much like a malfunctioning precision instrument, preventing organs from receiving the necessary repair and rest. This can particularly impair the kidney's ability to eliminate toxins. The kidneys are like the body's internal cleaners, responsible for removing harmful substances from the blood. If their function is impaired, these toxins can accumulate in the kidneys and the body over time, leading to kidney disease and other problems such as weakened immunity and cardiovascular disease. Reason 3. Excessive alcoholism. Alcohol seems to be an indispensable element in social situations. However, excessive drinking carries numerous health risks. Statistics show that people who drink at least 7 drinks per week are 30% more likely to have elevated blood creatinine levels than those who drink only 1 drink per week, or do not drink at all. Elevated blood creatinine is a strong indicator of kidney damage. When we drink alcohol, it's first metabolized in the liver. Alcohol dehydrations and acetylaldehyde dehydrations in the liver break down alcohol into acetylaldehyde, which is then partially decomposed into carbon dioxide and water. However, this process produces toxic substances, such as acetylaldehyde. These substances not only directly damage liver cells but also affect normal liver function. When the liver is damaged, its detoxification capacity decreases, and toxic substances cannot be effectively excreted, which places an increased burden on the kidneys. Long-term heavy drinking can also increase blood uric acid levels. Excessive accumulation of uric acid in the body can deposit in the renal tubulus, forming uric acid kidney stones, which block the tubulus and further aggravate the risk of renal failure. Furthermore, heavy drinking can easily lead to rhabdomyolysis. Rhabdomyolysis involves the extensive breakdown of muscle tissue, releasing large amounts of substances, such as mogollin and creatine kinase into the bloodstream. Elevated creatine kinase not only causes muscle pain and weakness, but also increases the filtration load on the kidneys, exacerbating kidney damage. Uremia, also known as end-stage renal disease, is a common outcome of chronic kidney disease. However, not all chronic kidney disease will progress to uremia. Early detection and intervention, such as lifestyle adjustments and alcohol consumption control, can effectively slow the progression of kidney disease and prevent the onset of uremia. So what factors can trigger uremia? 5 factors that trigger uremia you must know. Factor 1. Kidney disease. Kidney disease is arguably the #1 driver of uremia. In the early stages of kidney disease, many patients often neglect to adjust their lifestyle due to a lack of awareness of their condition. This oversight can accelerate the progression of the disease. For example, some patients often work late nights, leading to prolonged fatigue, which undoubtedly places an additional strain on the kidneys. Others engage in overeating, consuming excessive amounts of protein, salt, and other substances, which overloads the kidneys with the task of filtering and excreting these substances. Over time, this gradually impairs the normal function of the kidneys, making them more vulnerable to uremia. Factor 2. Hypertension. Hypertension and uremia are closely linked. Uremia is one of the most common and serious complications of hypertension. According to statistics, approximately 50% of patients with hypertension may develop uremia. When blood pressure remains high for a long time, it can damage the blood vessels and glomeruli in the kidneys, leading to a decrease in the kidney's filtration function. Therefore, patients with hypertension should actively cooperate with their doctor's treatment and effectively control their blood pressure through appropriate medication, dietary adjustments, and regular exercise. This will improve blood supply to the kidneys and slow the decline of renal function. Factor 3. Urinary tract infection. There is also a significant link between urinary tract infections and uremia. Both men and women can develop uremia due to urinary tract infections. In my country, urinary tract infections, such as chronic pyelonephritis and renal tuberculosis, are the second most common cause of uremia, accounting for 21%. Married women, due to their unique physiological structure, are particularly susceptible to urinary tract infections. Once a urinary tract infection occurs, bacteria and inflammatory factors may ascend to the kidneys through various pathways, triggering an inflammatory response and damaging the kidney's normal tissue structure and function, thereby increasing the risk of developing uremia. Factor 4. Diabetes. Diabetic nephropathy is one of the most common chronic complications of diabetes. A significant proportion of patients with diabetic nephropathy will also develop uremia, especially in those with poor glucose tolerance. Their high blood sugar levels can persistently damage the renal microvasculature, leading to thickening of the glomerular basement membrane and filtration dysfunction. Over time, kidney damage gradually worsens and may eventually develop into uremia. Therefore, diabetic patients need to strictly control their blood sugar levels and regularly monitor their kidney function to promptly detect and intervene in kidney disease. Factor 5. Medication toxic side effects. While treating illnesses, medications can also have adverse effects on the body. Statistics show that nearly 30% of renal failure patients suffer from toxic side effects from long-term medication use, which in turn leads to kidney problems and ultimately uremia. Common antipyretic analgesics, antibiotics, and certain traditional Chinese medicines, if used in large quantities and over a long period of time, can cause kidney damage. Therefore, when using medications, always follow your doctor's instructions and avoid drug abuse. Patients with chronic conditions who require long-term medication should especially undergo regular kidney function tests to detect potential kidney problems. Third, these 4 foods are uremia accelerators. What's your diet? First, foods high in salt such as pickles. Salt is an essential condiment in daily life. Moderate salt intake is beneficial for maintaining normal physiological functions. However, today's diet generally favors saltier foods, and excessive salt intake is a common problem in China. The average daily intake exceeds 10 grams, and in some provinces, it reaches as high as 15 grams, far exceeding the recommended daily intake. This excessive salt intake not only leads to excessive salt meals, but also significantly increases the burden on the kidneys. Excessive salt intake increases sodium ion concentration in the body, leading to sodium and water retention. This means that water is difficult to excrete from the body, further increasing the excretion burden on the kidneys. Long-term consumption can not only lead to high blood pressure, but also accelerate kidney damage. Furthermore, excessive salt intake can cause electrolyte imbalances in the body, impacting normal metabolic function. Therefore, to protect kidney health, we should minimize the intake of high-salt foods, such as pickles and preserved foods, and cultivate a light diet. Second, foods high in phosphorus. Phosphorus plays a crucial role in human metabolism, but its balance requires careful maintenance. Phosphorus in the body is primarily excreted through filtration in the glomeruli, maintaining a stable phosphorus level. Long-term consumption of foods high in phosphorus increases blood phosphorus levels, further increasing the filtration burden on the kidneys. This persistent burden increases glomerular filtration pressure, which over time can gradually reduce kidney filtration function. Furthermore, hyperphosphatemia can lead to a series of complications, such as renal loss and cardiovascular disease, further impacting patients' quality of life. Therefore, it's important to control your intake of foods high in phosphorus, such as seafood, animal liver, egg yolks, and dried fruits, to reduce the burden on the kidneys and protect their health. Third, starfruit. Starfruit, a fruit with a unique appearance and a sweet taste, carries a hidden danger. Starfruit contains a neurotoxin called carambotoxin, which can affect the human central nervous system and cause abnormal brain activity. For healthy individuals with normal kidney function, consuming a small amount of starfruit generally poses no threat, as the toxin is filtered and excreted smoothly through the kidneys. However, for those with impaired kidney function, especially those with chronic kidney disease or a history of kidney disease, starfruit can be a dangerous food. Because their kidneys are unable to effectively filter and excrete the toxin, the carambotoxin accumulates in the body, causing symptoms of poisoning such as persistent hiccups, vomiting, seizures, impaired consciousness, and even coma and death. Therefore, for safety reasons, individuals with kidney disease or a history of kidney disease should avoid consuming starfruit to prevent worsening of their condition or the development of serious health problems. Force-type lamb. Mutton is a common meat, especially in the fall and winter, when many people enjoy it for nourishment. However, lamb is high in purine, which produces uric acid when metabolized in the body. Excessive consumption of lamb can easily lead to elevated uric acid levels. When uric acid levels are too high, uric acid crystals form and deposit in joints, kidneys, and other areas, causing gout and kidney damage. Furthermore, lamb contains a high amount of animal fat, which is difficult to digest. This fat places a heavy metabolic burden on the liver. Long-term accumulation can lead to fat accumulation in the liver, impairing normal liver function. Excessive fat intake can also cause renal arteriosclerosis, leading to insufficient blood supply to the kidneys and, in turn, kidney atrophy and degeneration. This condition can gradually develop into arteriocyclic nephropathy, seriously affecting kidney health. Therefore, while lamb has certain nutritional benefits, it is important to control the amount consumed. Those with elevated uric acid levels or those at risk for kidney disease should be especially cautious when consuming lamb to avoid adding burden to the body and causing health problems. For once uremia develops, it's toxic throughout the body. Uremia affects not just the kidneys, but the entire body. A fact many people don't realize. Damage 1. Skin. A complication of uremia is hyperphosphatemia, which occurs when excessive phosphorus levels in the body prevent it from being excreted through urine. Some toxins attempt to be excreted through sweat. If the phosphorus content in sweat is too high, it can cause itching. Additionally, other skin lesions may develop, such as hyperpigmentation and purulent infections. These skin problems not only affect the patient's appearance but can also cause severe discomfort and pain, further impacting the patient's quality of life. Damage 2. Digestive system. The body's three main pathways for excreting toxins are urine, sweat, and feces. When the primary route, urine, is blocked, sweat and feces take on more of the toxinal emanation burden. As the disease progresses, gastrointestinal symptoms become increasingly pronounced. Initially, patients may experience only loss of appetite, nausea, and vomiting. However, as endogenous toxins accumulate, they gradually irritate the gastrointestinal mucosa, causing fibrinous inflammation, ulcers, and even bleeding. These digestive problems not only affect nutritional intake, but can also lead to serious complications such as gastrointestinal bleeding and perforation. Harm 3. Hematologic system. Patients in the uremia stage often experience anemia. This is due to impaired kidney function, which reduces erythropoietin secretion and affects red blood cell production. To alleviate anemia, patients often require erythropoietin injections to boost blood production. However, long-term reliance on erythropoietin may lead to other health problems, such as an increased risk of hypertension and cardiovascular disease. Uremia can also cause coagulation disorders, increasing the risk of bleeding and thrombosis. Harm for nervous system. The nervous system effects of uremia typically manifest in the early stages with headaches, fatigue, irritability, and severe insomnia. As the disease progresses, patients may develop symptoms such as impaired consciousness and coma. These neurological problems not only affect daily life, but can also lead to cognitive decline and mental impairment. Uremia can also trigger peripheral neuropathy, leading to numbness, tingling, and movement disorders. Harm 5. Cardiovascular system. The cardiovascular system of patients with uremic kidney disease becomes extremely fragile and vulnerable. Cardiovascular disease primarily manifests as heart failure and arrhythmias. While these symptoms typically appear in the middle or late stages of the disease, once they occur, they can pose a serious threat to the patient's life. Heart failure can cause shortness of breath, edema, and fatigue, while arrhythmias can trigger fainting, angina, and even sudden death. Furthermore, uremia can accelerate atherosclerosis, increasing the risk of myocardial infarction and stroke. Once diagnosed with uremia, aside from lifelong dialysis, the only option is a kidney transplant. However, uremia does develop without warning. It's often the result of a combination of poor lifestyle and dietary habits. Therefore, regular kidney function tests are recommended for early detection and intervention. Many people are completely unaware of kidney disease in its early stages. However, the most common symptoms, such as fatigue, nausea, lower back pain, foamy urine, and increased nocturia, all these seemingly insignificant complaints, are silent yet powerful warnings that your kidneys may be failing. Get checked out now. Don't wait until your condition deteriorates beyond repair before regretting it. 5. These four foods are beneficial for kidney health. Consume them every other day, and you'll live to 99 without kidney disease. First, pumpkin. People with kidney deficiency need plenty of starch to boost their energy. However, starchy foods are often high in sugar, which impairs the kidney's ability to filter sugar. For those struggling with kidney deficiency, pumpkin is a great option. Pumpkin is high in starch but very low in sugar, which can help slightly reduce the glomerular filtration process and lower the glycemic index. Pumpkin is also rich in carotenoids, just like other yellow fruits like sweet potatoes and carrots. These compounds act as antioxidants and may help reduce the risk of certain cancers. Furthermore, the combination of pumpkin's vitamins A, C, iron, and many other nutrients helps create a natural barrier against cancer cells. Furthermore, The sterols in pumpkin seeds have been shown to have anti-cancer properties. Second, read bell pepper. For those with kidney deficiency, a quick recovery is crucial. Doctors recommend adding bell peppers to their daily diet. This vegetable is rich in vitamins A, B6, C, fiber, and trace minerals like potassium and sodium. Bell peppers in particular contain a high amount of lycopene, a powerful antioxidant compound that may restore weakened kidney cells. They also provide folate, which supports red blood cell function and is especially important for pregnant women, as it helps prevent certain types of birth defects in their unborn babies. Bell peppers are also a good source of vitamin K, which is essential for blood clotting. Cooking bell peppers at low temperatures for a short time retains most of their sweetness and flavonoid content, a valuable nutrient. Bell peppers of all colors are high in potassium, a mineral that helps maintain fluid and mineral balance in the body, strengthens muscle function, and regulates blood pressure. 1 cup of green peppers contains 261 mg of potassium, while red and yellow varieties provide over 300 mg per cup. Third, dark green vegetables. Dark green vegetables contain many beneficial phytochemicals, such as sulfates, glucosinolates, and indoles. These substances help eliminate free radicals, toxins, and waste products from the body. Furthermore, dark green vegetables are higher in omega-3s than other vegetables and should be consumed daily to effectively support glomerular filtration of the blood. Furthermore, most dark leafy greens are rich in cancer-fighting compounds that protect cells. Including dark leafy greens in your daily diet can reduce the risk of kidney, stomach, breast, and skin cancers. Furthermore, folate, found in dark leafy greens like spinach and bok choy, is essential for cell division and can help fight cancer development. Furthermore, dark leafy greens are rich in fiber and electrolytes like magnesium and potassium, as well as glucosinolates that help support liver detoxification. These vegetables also have the ability to relieve constipation, thanks to their high fiber content. Furthermore, these vegetables have numerous metabolic benefits and can help energize the body. This is because dark leafy greens contain B vitamins, folate, and iron, which help improve nutrient absorption. Fourth, cabbage. What foods are good for the kidneys? Cabbage is definitely on the list. It helps relieve stress on the kidneys. Cabbage often contains phytochemicals that help repel free cells that can harm the skin and body. Cabbage also helps nourish the kidneys, as its low potassium content helps reduce kidney stress. Cabbage is also high in vitamin C and vitamin K. Vitamin C boosts immunity, while vitamin K is essential for blood clotting. Cabbage is also rich in dietary fiber, which promotes intestinal health and indirectly reduces the burden on the kidneys. Including these foods in moderation can help maintain kidney health and help prevent kidney disease.